It's Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality care for long-term ventilated adults and children with tracheostomies, otherwise medically complex adults and children at home, which includes home BIPAP, home CPAP, also home tracheostomy care for adults and children that are not ventilated, also home TPN, home IV potassium infusion, home IV magnesium infusions, home IV antibiotics. We also provide port management, central line management, as well as Hickman's line management, as well as palliative care services at home. Today, I actually want to talk about a situation that we encountered recently, which illustrates once again why selecting a specialist service is so important. And selecting a specialist service that is specialized on ventilation, tracheostomy at home, that enables patients to leave intensive care if they're stuck in intensive care long term. So here's the following situation. We had an inquiry recently for a young man who is in his 30s, who is a quadriplegic. He is having a tracheostomy and he has been discharged from hospital. Initially, the family was hiring nurses online, right? Registered nurses online. There are a number of platforms online where the NDIS here in Australia allows, nurses to put their skills on like an app, and then clients can hire directly. And they initially hired a number of registered nurses to look after their son. Now it turns out, as soon as the registered nurses showed up on the scene, that they didn't know what a tracheostomy was. Well, that's crystal clear to me because, no registered nurses are exposed to tracheostomies if they haven't worked in intensive care for a period of time. That is why here at Intensive Care at Home, we exclusively work with critical care nurses that have a minimum of 2 years critical care nursing experience, right? Because that would give them sufficient exposure to work with tracheostomies. So needless to say, that the care of the family's son was falling apart pretty quickly and he bounced back into hospital. Needless to say that, the family then obviously was looking around what other options are there. And then eventually they found us, realizing because we are a specialist service working with critical care nurses, that we are the right solution for their son's care, and that's why, going on an app and trying to select nurses there, that's fine. It's a bit like the Uber app, where you push the button and the car comes. Here it's a bit like, well, you push the button and the nurse comes. However, no one is checking their qualifications. No one is matching their qualifications with the right client. And that's one of the downsides. Now, the other thing is, with those online apps, they're not sending you nurses that are working with a third-party accredited service provider, which is what we are here at Intensive Care at Home. With Intensive Care at Home, we are, as far as I'm aware, the only provider in 2024 that has achieved third-party accreditation, including NDIS accreditation for intensive care at home nursing. There is no other provider who achieved this level of accreditation and has built the intellectual property around it. Not only do we work exclusively with critical care nurses with a minimum of 2 years critical care nursing experience, more importantly, we are employing hundreds of years of intensive care nursing experience that we send into the community, which enables us to run like an ICU in the community with long-term ICU patients, right? But they still have community access. That's the big difference, that instead of being stuck in ICU, our clients have community access. They can participate, in the lives they want to live and are not stuck in an ICU. There's a big difference there. But the bottom line is, we have a team of critical care nurses in the community that can look after ventilation, tracheostomy, BIPAP, CPAP, home TPN, and the list goes on. And we can do it seamlessly because we've done it with so many clients over the last 10 years since we've been in business. So I hope that video helps you to make a decision when you have a loved one or in intensive care and you want to go home, or you're at home already and you don't have the right support. You're wondering, why do the nurses not know how to manage tracheostomy? Why do the nurses not know how to manage a suprapubic catheter? Why do the nurses not know how to manage a PEC tube or a nasogastric tube? You know, that is our area of expertise, and we are third-party accredited for it. Now, with intensive care at home, we are currently operating all around Australia and in all major capital cities, as well as in regional and rural areas. We are an NDIS accredited service provider. We are a TAC approved service provider in Victoria, iCare in New South Wales, NIISQ in Queensland. We are also a DVA approved service provider all around Australia. We have received funding through public hospitals, private health funds, as well as departments of health. We are also providing level 2 and level 3 NDI support coordination, which would also be critical in a situation like that to get onto the NDI scheme in the first place. And also, it's also very important for you to know that we practice intensive care at home according to the evidence-based mechanical home ventilation guidelines, which you can find on our website, which once again say that you need a critical care nurse at home with a minimum of 2 years critical care nursing experience to look after someone on a ventilator and or tracheostomy at home, and all the other subspecialties we're providing care for at home, such as home TPN, port access, central line management, peak line management, BIPAP, CPAP, and the list goes on. So go and check out the mechanical home ventilation guidelines, which are evidence-based. We're also sending our critical care nurses into people's home or into residential aged care facilities to avoid emergency department admissions and provide an emergency bypass service. If your hospital is interested in doing the same for your emergency department, please reach out to us now here at intensivecareathome.com. And if you are an NDI support coordinator and you're looking for nursing care for one of your participants, please reach out to us as well. Or if you don't know how to go about getting nursing care through the NDIS or through other insurance schemes, please reach out to us. We can also do NDIS nursing assessments for you. And if you are a critical care nurse and you're watching this and you have a minimum of 2 years critical care nursing experience, ideally with a postgraduate critical care nursing qualification, we want to hear from you. We currently have jobs in Melbourne, Sydney, Brisbane, Albury, Wodonga, Bendigo, and in Warragul in country Victoria. So we have a wide variety of job opportunities for critical care nurses that have the right mindset and have the right skills. Also, I need to stress, we are a service provider that has a tailor-made solution for our clients, and we pride ourselves on that. That means if you are a critical care nurse interested in working with intensive care at home, we're really looking for staff that can give us regular availabilities and that are reliable. Reliability is not negotiable at all. Our clients want regular staff. We want regular staff, and that's why we have a tailor-made solution to our clients. We don't have people that come and go. That doesn't work for us. So please only apply if you are genuine in wanting to work with us and our clients long-term so that you can get to know our clients and their families and vice versa. We want to build relationships with our clients. But also, we want to build a relationship with you, of course. Now, and if you're watching this and if you are at home already, or you have a family member at home already and you have insufficient support, or if you are in intensive care, and you and your family want to go home or you need more support, please reach out to us as well. You can reach out to us at intensivecareathome.com, call us on one of the numbers on the top of our website, or send an email to info@intensivecareathome.com. And if you are an intensive care consultant or an ICU specialist and you're looking for a career change, we are also currently expanding our medical team. And if you're an ICU consultant working in ICU and you have bed blocks, we want to hear from you as well. We can help you eliminate and manage your bed blocks. And if you're a hospital executive watching this, we also want to hear from you. Once again, if you've got bed blocks in your hospitals, in your ICU, and in your ED, we can help you eliminate all of that, and you don't even pay for it. So please reach out to us as well. Once again, all of that you get at intensivecareathome.com. Call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. And lastly, if you are in the US or in the UK and you need help, please reach out to us as well. We can help you privately. And the area where we can probably help you the most is Dallas in Texas. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. click the like button, click the notification bell, share the video with your friends and families, share it far and wide, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer questions live on a show. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I'll talk to you in a few days. Take care for now.